Hi guys, this is David Villar, and on this short video we're going to say a few things about Tramadol because it has become very popular in veterinary medicine due to its wide margin of safety and low potential for abuse. And however, this is the perfect example of a drug that you cannot extrapolate between species. And as Dr. Ferguson highlighted in one of his presentations, in the absence of evidence, you have to use your comparative pharmacology skills to decide whether it may be possible to extrapolate to another species. And the bottom line is that most clinical evidence suggests that it's unlikely to have any meaningful benefit in dogs. This is a different story in cats. It seems to be better than some of the non-steroidal anti-inflammatory drugs. So how come that is used so much by veterinarians? Well, all of a sudden, everybody started using it without real evidence because it's so common in human medicine. It kind of caught on like a wildfire, so to speak, in the social media. But hopefully that trend will change with all the research evidence that is coming out in recent years. So we'll see what happens. So, because it's been on the hot plate for recent years, there are now studies to dispel the myth, and this is one of them. The title, as you can see, is Lack of Effectiveness of Tramadol Hydrochloride for the Treatment of Pain and Joint Dysfunction in Dogs with Chronic Osteoarthritis. This was a randomized, blinded, placebo and positive control crossover study, which is really a very well-designed study. Dogs were included in the study if they exhibited elbow or stifle dysfunction and signs of osteoarthritis, and they were excluded if they received corticosteroids, glycosaminoglycans, surgery, or had any other disease prior to the study, or at any time point during the study. The treatment included a control, carprofen, tramadol, and there was a washout period of 7 days between treatment groups. And pain was evaluated according to the canine brief inventory scores and the more objective force plate gait analysis, which is actually a measure of how much force is being put on those legs. If we look at the results, we can see that dogs that were given carprofen had significantly higher vertical impulse and peak vertical forces between baseline, that is before the treatment, and at 10 days after treatment, whereas the tramadol didn't really have any effect whatsoever compared with the placebo. That means that dogs now would put more weight on those limbs than they did before the treatment. And that's really a more objective endpoint than the other one that they measure, which is the canine brief inventory, which is actually a series of questions that the owner answers on the severity of the pain and how much is that pain is interfering with the daily activities of the dogs. And based on the owner's opinion, they came up with a score for the animal. In any case, there were no differences between the tramadol and the placebo according to the owner. 7 and 8 of the animals out of the 33 got better, and with the tramadol, 14 out of the 33 for the carprofen group got better, and that was statistically significant from the other two groups. So if we look at some of the conclusions from the discussion, they said that the promotion and proliferation of tramadol for groups with osteoarthritis over the past 10 to 15 years are now a curious phenomenon. It may have evolved from the use of non-peer review venues, basically the social media, as I was mentioning before. And the use of tramadol is a classic example of failing to acknowledge and control for bias when evaluating a potential treatment. Now, everything we learn about metabolism is important. In this case, tramadol is inactive until it gets biotransformed into its active metabolite, which basically takes place in the liver and to some extent in the intestines by cytochromes P450s. And as you can see here, there are two major metabolites, M1, which is the active one, and M2, which is the inactive form. This paper basically partly explains why tramadol may not work in dogs, but it actually does in cats. Here basically they took liver of dogs, cats and humans, and they put them in a test tube, and they determined how much of each of those metabolites is being produced by those cytochromes. And basically the mechanism of action, if we were to say something about that, of the active M1 metabolite is basically through binding weakly to the mu opioid receptor. And it also seems to increase the level of norepinephrine and serotonin in the brain, which is something that it's kind of unique to this type of opioid, which doesn't tend to happen with any of the other ones. In some dogs, it may be confused with pain relief or analgesia, and by increasing serotonin, which is actually what antidepressants do, they make it some kind of state of feelingness or happiness, and that should probably not be confused with pain relief. Now, if we look at the results of this paper, we can see that the dog's liver microsomes produce 4 times lower of the M1 metabolites than the cat's microsomes, but produces 5 times more quantities of the inactive M1 than the human, and 9 times more than the cat's microsomes. And when this was expressed as the M1 to M2 metabolite ratio, about 3/4 less than the human liver microsomes, and 19-fold less than the cat's liver microsomes. So basically the conclusion of this study was that the reason why dogs may have lower circulating concentrations of the active M1 compared with humans and cats is probably because they produce a lot less of the active form and a lot more of the inactive metabolite. So having said all this, I'm gonna dismiss you guys here. So take care and bye bye for now.